Good morning, everyone. Thank you for joining us for our webinar today, What's in Your Water? Legionella and Lead Risks Related to Reopening Buildings. Presenting today will be Forensic Analytical's very own Megan Canright and Madeleine Rebullida, who you see there on your screen. Megan has a master's in public health and is a certified industrial hygienist with over 15 years of experience. She's the leader of the Legionella and Water Quality Practice Group at FACS, with her primary area of expertise being in the evaluation and control of Legionella and other waterborne pathogens in support of infection control. Madeleine Rebullida is a project manager for FACS out of our Bay Area office and is also a leader in the FACS Legionella and Water Quality Practice Group. She's worked on many water quality projects and partners with clients to implement waterborne pathogen management plans in a variety of settings. Before I hand it over to Megan and Madeleine, I'm going to quickly just cover that if you have any questions that come up throughout the presentation, please put them in that questions box that you'll see there on your control panel, and we'll have a full Q&A session at the very end of this that we'll go over. And with that, I'll hand it off to Megan and Madeleine.
Thanks, Taylor. So we think we've got a great webinar planned for you today. We're going to just talk about a little bit about the current situation. You know, we're reopening buildings, finally getting to a situation where we're getting back to work and normal life. So we want to talk about what that means in terms of your water. So we're going to discuss the hazards and risks of two sort of related hazards, Legionella bacteria and lead and copper. We'll share with you some of the regulations and industry guidance that surrounds these issues. And then we'll finish up with water management plans and what that might mean for you and your buildings, facilities, et cetera. Okay, so we've been dealing with COVID-19 for the past year and a half now. We've had total shutdown of some buildings since March of 2020. And this is for essentially all non-essential businesses. So if you're not healthcare, not an essential business, it's very likely if there's an office space or some other type of business that hasn't been deemed essential, that building has either been partially or completely shut down for upwards of a year, almost a year and a half now. For those buildings that are essential businesses, those may have had partial closures, limited occupancies, and fluctuating number of people coming in and out of the building. And so certainly this has impacted the way that the building operates. And because cases and deaths are now trending down nationally, this is great news in terms of COVID-19 and getting back to some sense of normalcy. But many states are sort of removing those occupancy restrictions and starting to allow businesses to reoccupy. So again, this is great news for COVID and getting back to business, but definitely something we need to think about before reoccupying is the health of our buildings and sort of where they stand with respect to operation. And one of those aspects that we're going to talk about today is water. The CDC recognizes that there are some concerns with water quality coming back to a state of normal occupancy. So temporary shutdown, reduced operations, could have resulted in reduction in normal water use, or likely has resulted in reduction in normal water use. And this can obviously create some hazards for returning occupancy. So CDC recommends that building owners and operators and businesses check for these hazards, do a risk assessment before reopening after any prolonged period of building inactivity. And they give us a little bit of guidance about what prolonged period of inactivity means. And this is largely related to water stagnation. So the water has been stagnant for prolonged periods. So for Legionella, a prolonged period might be weeks or months, according to the CDC. For lead and copper, we have a little bit more stringent definition there. A prolonged period might be hours, days, weeks, or months. So certainly with the pandemic, building closures fall within these prolonged period definitions. And so building owners and operators should be aware of the hazards and address them with appropriate risk assessment and control measures before reoccupying. Also note that CDC, we're going to be focusing on Legionella, lead, and copper, but there are other potential hazards, whether bacterial, chemical, biological, et cetera, that might be associated with stagnant water conditions, things like non-tuberculous mycobacteria, disinfection byproducts from chlorination, et cetera, sewer gases entering buildings through dry sanitary sewer drain traps. These can all be issues as well. We're just going to focus on these two, but there are, it is important to perform that entire risk assessment so that all hazards are identified and addressed. So we're going to start with lead and copper. We know that lead is harmful to health, human health. We know there's no safe level of lead. EPA is very clear. Lead has significant concern, especially with CNS system development in children whose brains and neurological systems are still developing, and also can impact the reproductive health of adults as well. Metals such as lead and copper can enter the drinking water from corrosion of plumbing. So plumbing components can have lead and copper in them. And because of contact with water and other corrosive materials that are in water, those metals can leach out of the piping and enter the drinking water supply. And this corrosion can really occur during periods where there's low or no water use, so water stagnation. The more the water is in contact with the piping, the more likely leaching can occur. And corrosion is basically, it's pretty normal part of plumbing systems and water systems. It's a chemical reaction that essentially wears away the protective coatings that are inside plumbing materials and exposes those metals, those untreated metals, to the water, which can increase the rate of corrosion and the rate of leaching as time moves on. So the older the pipes, the more likely leaching can occur as well. Lead is not a new issue with COVID and building closures. Lead and copper contamination have been a concern that have been known by the EPA for some time. EPA estimates that up to 20% of a person's lead exposure actually comes from drinking water. So we do expect lead, because there's lead components and copper components in the water supply and the water system serving many buildings, we do expect there to be some level of lead exposure that comes from drinking water. There are still lead service lines in place in the US, particularly in residences. And we also know that lead pipes and fittings are expected to be somewhat prevalent in the US. There haven't been a lot of studies to say how prevalent they are, but we know that they're present, particularly in older buildings before lead-free fittings were required in buildings. And as I mentioned previously, according to the EPA, there's really no safe level of lead, especially for children. The graphic on the right just shows you US PIRG. They've done an assessment to identify or to grade the states, the US states, on how well their schools are doing in terms of getting the lead out of the water. And you can see that a majority of the states that have been assessed are receiving an F grade. This means that they're either not doing sampling, the sample results that they're getting are above the action limits, they don't have a lead program, flushing program, or a lead management program. So again, lead is not a new issue, particularly in schools. And as such, there are some regulations that govern lead and copper in drinking water. There's the Safe Drinking Water Act. The Safe Drinking Water Act applies only to public water suppliers. So this is the municipalities that are supplying water to facilities. And it authorizes EPA to set these maximum contaminant levels. And we'll talk about the maximum contaminant level, particularly for lead in a little bit. And it requires those public water systems or supplies to perform testing to make sure that their water complies with those maximum contaminant levels. And there's a maximum contaminant level for lead and other constituents as well. We also have the lead and copper rule. This extends the Safe Drinking Water Act to apply inside of buildings. So this requires the public water supplies to test for lead and copper in the supply water and sometimes also at points of use. And it requires action for the public water supply to reduce corrosivity to prevent lead and copper exposure and protect public health. So there's several reference levels that we have regarding lead in drinking water. As I mentioned, the EPA sets this maximum contaminant level. For lead, they've determined that it's not feasible to set a health-based maximum contaminant level. The reason for this is that EPA knows that lead is pretty prevalent in water supplies, and so it's not feasible to set a health-based standard. Instead, what they do is they've set an action limit that they believe public water suppliers can meet with the current infrastructure and technology available, and that's 15 parts per billion. They've set a regulatory goal. This is the maximum contaminant level goal of 0 part per billion. This goal is not legally enforceable, but it is something that the EPA states that they would like to achieve. The Office of Environmental Human Health Hazard Assessment, OEHA, this is a California operation, has set a public health goal that is based on neurobehavioral and neurological effects in children who are exposed to lead, as well as some of the blood pressure effects and reproductive effects in adults. And so they've set this health-based level at 0.2 part per billion. Prop 65, another California regulation, sets a warning level similar to the OEHA public health goal of 0.2 part per billion. And then the American Academy of Pediatrics has recommended an action threshold. So this is similar to an action limit of 1 part per billion. So you can see that juxtaposed with the EPA's action limit and how much lower it is. And then FDA has a quality limit for bottled water of 5 part per billion. And that is not a health-based level either. That is, again, an achievable or feasible limit based on the limitations of filtration and bottled water processing. So CDC provides some guidance for what should be done with building closures, partial or full building closures and building stagnation in order to reopen. And it's interesting because CDC has, while this guidance document is on the COVID-19 information page, COVID-19 isn't really mentioned anywhere on the page. So it really does step outside of the pandemic and really applies to any building closure, whether that's related to a pandemic or not. So anytime that there is prolonged stagnation, these are the steps that CDC recommends. So first of all, understand how water comes into your building. It's really important when you're trying to control for lead and Legionella to understand how the building supply enters the building and how it's distributed. They recommend testing water for lead using an EPA certified drinking water quality laboratory, and that those samples only be collected from potable water faucets used for drinking, cooking, or cleaning dishware. And that dishware is intended for use when eating or drinking. There's no requirement to sample. This is a recommendation to sample. They also recommend that only cold water be used for drinking and cooking, that the aerators, this is that little flow device that's on the outside or the end of the fixture. They recommend that those aerators be cleaned regularly because debris and other materials, certainly lead particulate, can build up on the backside of those aerators. And so doing preventive maintenance and proactive cleaning of those aerators is really important in terms of controlling for lead. And then if filters are in place in any particular water system, it's recommended that those filters be used, maintained, changed properly in accordance with the manufacturer's recommendations. And so all of these steps, all of these recommendations, CDC recommends in addition to performing flushing. So flushing is a really important way to move water through a system to counteract stagnation. So flushing programs are often a large part of lead management and Legionella management programs. However, the CDC is really clear that flushing alone does not necessarily prevent the release of lead into drinking water because you're still moving that water over potentially lead containing components. And so they recommend these additional steps to supplement a flushing program to adequately control lead in drinking water. And Madeleine, I'm going to pass it over to you.
Thanks, Megan. Sorry, I'm a slow mouse clicker. Let me make sure I can. I think you have to hand me the.
Yeah, it says that you've got it. So I can always advance for you if it won't advance.
That's weird. I was able to do it a minute ago.
All right, I redid it. There we go.
Oh, now it's working. Terrific.
I think there's a delay. Okay. Sorry, everyone, for the technical difficulties.
You'd think 15 months into nonstop Zoom calls, we would have this locked down. So in addition to lead in water, the other potential hazard that is present when you have stagnant or low use conditions in a building water system is related to Legionella. Legionella is a bacteria. It's not a fungus or a virus. It's a bacteria that causes disease in humans. This is a bacteria that is naturally occurring in water and soil, and so you expect to have it in some low level concentration in the water. But the risk of this bacteria is attributed to when it is able to amplify or grow within a water system. And it does that by forming these biofilms, and you can see that kind of gooey picture down at the bottom there. And it's able to create sort of a safe little space for itself where it can replicate and reproduce and then escape into the water system. The way that you are exposed to Legionella is through aerosols. Similar to how COVID is transmitted, it's an airborne virus. This is a bacteria that can be transmitted in these really small droplet nuclei, and it happens when you breathe it in. And people that are at higher risk for exposure to this bacteria or developing a disease from exposure to this bacteria are people who are older or have underlying health conditions. So there's special considerations for hospitals and healthcare facilities with respect to control of Legionella in water systems. And up until very recently, up until last year, the CDC really kind of singled out healthcare facilities as needing to have these water management programs to control Legionella. And to that end, the Center for Medicaid Services dictates that hospitals and healthcare facilities have to have a water management program. In light of COVID and the number of buildings and facilities that now have been shut down and have these stagnant water conditions, the CDC has created some additional guidance for that. We'll talk about that in just a moment, but the risk factors for Legionella growth in a water system, as we talked about, of course, low flow conditions, so stagnation or dead legs, and Legionella likes to grow within a specific temperature range between about 68 to 120 degrees Fahrenheit. So recommendations for controlling temperature in your system are to heat your hot water to 140 degrees. There are anti-scalding regulations, excuse me, where you're not allowed to deliver water over 120 degrees. So the recommended delivery range for temperatures in your hot water system is between 77 to 113 degrees Fahrenheit. Other conditions that can contribute to Legionella amplification or growth is if there is low or no disinfectant in the water. So your municipal water district treats your incoming water with a disinfectant, typically chlorine or monochloramine, and by the time that water gets to your facility, and then by the time it gets to the faucet, the amount of disinfectant that's present in the water can change a lot depending on a few different conditions. So monitoring disinfectant levels is something to consider, as well as monitoring your temperature. We'll talk about all these different control measures in detail later on. Also, if water is held at really high temperatures for a long period of time, it can also reduce the amount of disinfectant in the water. Corrosion and scale, a lot like what Megan was saying with lead, where stagnant water can cause corrosion and scale, and that can create a lead hazard. Corrosion and scale creates this sort of excoriated rough surface that the bacteria can form biofilms in. And so it makes all these like little nooks and crannies. And, you know, that's why having that flushing program is recommended for lead as well as Legionella.
Madeleine, I'm just gonna, sorry to interject really quickly. I think there was a misspeak there. The target delivery range, the growth range for Legionella bacteria, the ideal growth range is between 77 and 113 degrees Fahrenheit. You don't want to deliver your hot water within that range. You want to, your cold water should be certainly less than 77 according to CDC, and your hot water should be above 120. So just wanted to clarify that for people, and sorry for interjecting.
Yes, thank you. I did misspeak. So cold water colder than 77, hot water hotter than 113. Yeah, don't deliberately create perfect growth temperature conditions in your hot water delivery. So I talked a little bit about how you're exposed to Legionella. This is just one way to illustrate these concepts all together. So if your supply water has low disinfectant, if you have stagnant conditions, favorable temperature range, and then corrosion and scale where all these biofilms can form, then as the water moves through the fixture, as it comes out of the fixture, and the example here is a shower head, it can become aerosolized and the bacteria will be free flowing in that water, and then it's inhaled into the susceptible person's respiratory tract. So Legionella cases are on the rise. You know, we sometimes think of Legionnaire's disease as, you know, something that, you know, happened back in the 70s, and now we've got it well under control because we know about it and we have all these rules and regulations. And part of the reason that, you know, these numbers are on the rise, you know, some of it is we're doing more testing. There's more surveillance and monitoring for Legionella. Also, some of the regulations are a little bit more focused on different components within a water system, such as a cooling tower, rather than maintaining the water system as a whole and having a more managed holistic approach to controlling Legionella. So I talked about the focus on healthcare facilities because of the high-risk populations that they have. Now, with so many buildings being closed down and schools closed for long periods of time, hotels, all different types of non-healthcare facilities, while they don't have a consistent high number of high-risk occupants, due to the stagnation in their water system, they now have a high-risk conditions for developing Legionella biofilms and different bacterial biofilms. And these are just some of the headlines of recent outbreaks in non-healthcare facilities. So Megan talked about some federal regulations regarding lead and copper. So we're going to look at the Legionella side of this. The EPA discusses Legionella under their surface water treatment rule with regard to a maximum contaminant level goal. And if you remember what Megan was saying, this is an ideal goal. This is not an enforceable regulation of 0 Legionella organisms for drinking water. There is no primary drinking water standard for Legionella, and monitoring or sampling for Legionella is not required. Other guidance related to Legionella control comes from ASHRAE, which is the American Society for Heating, Refrigeration, Air Conditioning. They set all of this guidance related to different building systems like HVAC and water systems. And they have a standard 188 for control of Legionella in water systems, and then for managing different systems and components within the building. And that applies to all types of building facilities. They have a special annex for healthcare because of those considerations. And then, as I said, CMS, or the Center for Medicare Services, that applies to healthcare facilities only. And then the CDC has developed a Legionella toolkit that's based on that ASHRAE guidance. And it provides sort of a more simplified step-by-step process of how to create a water management program. We'll talk about that a little bit more. Now, CDC is not a regulatory agency. They provide recommendations and resources for all different types of disease control. And specifically with Legionella, they have quite a number of resources related to assessment and sample collection and interpreting those sample results. Sorry, there's a little delay when I click. So let's go back to that public health agency response that Megan talked about at the beginning. This is their guidance for reopening buildings. They talk about Legionella being a hazard if buildings are closed for a prolonged period. So these are the steps that they recommend. So with lead, we saw those 6 steps. First, you know, in addition to flushing, do these other 6 things. For Legionella, these are their 8 steps to minimize Legionella risk. The first step is to develop a comprehensive water management program. Now, this is a big step for the CDC to put out as a recommendation for all buildings. And this is a a fairly new thing for them. As I said before, they were more focused on the healthcare facilities. But as I said, they have a lot of great tools for developing these programs, and we're going to look at that in just a moment. Heat your water. So ensure that your water heater is set to 140 degrees. Flush your system. Clean decorative water features. If you have them, fountains, ensure that if you have hot tubs or spas, that those are safe for use. And then ensure that your cooling towers are clean and well maintained. They do indicate also looking at your fire sprinkler systems, eye wash stations, safety showers, that those are clean and well maintained. For your fire sprinkler system, don't try to flush your fire sprinkler system. That's something that you would work with a sprinkler vendor to come out and look at that. And the fire marshal has a specific program and rules for how those are set up. And then the last step is maintaining the program. So essentially make a plan, ensure that your water is heated correctly, that your delivery temperatures are correct, have some kind of flushing program, and then clean and maintain your system. There are other regulated water pathogens. So the EPA, as part of their primary drinking water regulations, these are mostly gastric parasites, such as Cryptosporidium, Giardia, and norovirus. These are things where, this is why you want to drink bottled water when you go on vacation to Mexico, because your body's not really prepared for some of these viruses that might be in the water. These are ones that are going to cause some upset stomach issues. The other thing that the primary drinking water standard looks at is total coliforms. Total coliforms are not a health threat in and of themselves. They're naturally present in the environment, and they are used to indicate whether there's a presence of a certain type of bacteria. It's not one species. So coliforms are kind of a different type of bacteria, a big group of bacteria. It's not one specific type, but within coliforms, probably the most common one that's known is E. coli. And there have been lots of E. coli outbreaks historically. So I just put this slide in because we're talking about federal regulations, and these are just some of the other water pathogens. When you're looking at that first step from the CDC guidance of developing a water management program, understand that that program helps to control not just Legionella, but other potential bacteria that may be in the water. So determining whether or not your building needs a water management plan. So we looked at that CDC reopening guidance. Their first step says, make a plan. They also have a worksheet, a little checklist that you can go through to determine whether or not you need this water management plan. They reference their toolkit and their module resources. Just know that this checklist does not apply to single family homes or private residences. So the first thing they look at is healthcare facilities, obviously, and then other factors. Does your building primarily house people over 65? Does your building have multiple housing units and a centralized hot water system, like a hotel, or you have a boiler room with a central hot water processing place where the water is distributed throughout the facility? And does your building have 10 or more stories? As you go through the checklist and you're answering yes or no, they also have you look at some different devices in the building. So if you have cooling towers, if you have hot tubs or spas, decorative fountains, or any other aerosol generating equipment such as a mister or humidifier, things like that. If you answer no to all of those, but you do say, if you answer no to the first set of questions about the type of facility, so no one over 65, no centralized hot water processing, building is not more than 10 stories high, but you do have one of these different devices, such as a cooling tower, a hot tub, then yes, you still need to have a water management program. If you answer no to all of those questions, they still recommend that you have some sort of process in place to maintain your system and address any potential high-risk occupants. So these are the different resources that I mentioned earlier from the CDC. In 2017, they put out this toolkit for building facility owners to develop a water management program. And then recently, as of January of this year, they also developed these modules. And there are modules, individual modules for different systems. So there's one for your potable water system. And then if you have a cooling tower, hot tub, decorative fountain, and then other devices. And that would be those misters or other aerosol generating devices that we talked about. They focus on the ASHRAE guidance in these documents. Now, those ASHRAE guidance documents are resources that are available to you. You do have to pay for them. And we did put a handout attached to the webinar that has links to the CDC site that can take you to where you can go to purchase those guidance documents. I don't know that any of you would be as interested in reading guidance documents as an industrial hygienist would be, but they're there for you to as a resource. So developing a water management plan. What do those steps look like? It is a process, so it's a linear process, but any type of safety program that you're going to develop and create is an ongoing process, right? It requires annual review, frequent revision, and so there's sort of a continuum of how this program is developed and implemented. And very simply, first step is you form a team of people who's going to oversee the administration of the program. That's a really critical piece. Then you want to assemble all of the relevant plumbing diagrams and history on the facility. You'll do a site assessment to identify what potential hazards are there, and that's focused on some of those risk factors we talked about: temperature, flow, corrosion, disinfectant. Then, based on the identification of those hazards, you're going to develop some different control measures to control those hazards, a program to monitor and correct when those different targets are out of range, and then a process for assessing the program. So that is referred to as verification and validation. The verification of the program is, are we doing it right? Are we implementing the program as we said we were going to implement it? And then the validation piece would be to test whether or not it's working, which would involve sampling for Legionella, and we'll talk about that too. And then ongoing documentation, review, and revision. This is where the team comes in as part of that annual review. So I'm going to hand it off to Megan here to talk about the identification of hazards, developing those controls, and what that looks like as your program documents.
And this really does apply to both Legionella and lead, and we'll talk about that in a little bit, but there are definitely some similarities, and implementing a water management plan can be, for Legionella, can definitely be effective in helping to control for lead and other water contaminants as well. So this is an example of a water process flow diagram. This is a really critical step in developing a water management plan. It's really critical to understand how the water is distributed, how it comes into the building, how it's tempered, heated, and sent out to the building fixtures. So going through the process of reviewing plumbing plans, looking at the building, and doing a building survey can really help you to get an accurate process flow diagram that really depicts how water is delivered to points of use. Once you get that process flow diagram in place, you can use that process flow diagram to help identify areas of potential hazard. So with Legionella, we mentioned that temperature within the growth range of the organism is certainly a hazardous condition, water stagnation, lack of disinfectant, low or no disinfectant, and then the ability to aerosolize, so something like a shower head or a decorative fountain or certainly a cooling tower. For a healthcare facility, there might be an area where you identify sensitive patient equipment, something that might be at risk, like potential humidified ventilators, maybe cardiac units, or areas where there may be sensitive patients, like a bone marrow transplant unit or an ICU. And so you can certainly identify areas of risk for specific populations as well. And then we also have external hazards that are potentially outside of our control. If there's a main break, if there's construction going on in the main outside of the building, you definitely want to identify those hazards as well. So this process flow diagram is a really great way to put the process flow onto one page and also identify the areas of risk so that those areas of risk can all be identified and control measures can be implemented for each hazard. And then here's an example of how the same process flow diagram, where those hazards have been identified, can be utilized to implement control measures and establish control measures. So where there are areas of temperature that could be within the growth range of the organism, temperature monitoring may be important to implement. And monitoring that temperature over time, making adjustments to the heater set points to ensure that you're outside the growth range of Legionella. Implementing flushing in areas where you've noticed or observed stagnation or low flow. Monitoring disinfectant in areas where you think that there could be low or no disinfectant. And then performing visual inspection in areas that might be subject to biofilm development, scale development, things like shower heads that can be scaled easily, things like aerators that we mentioned previously that can be subject to debris and biofilm buildup. So again, this process flow diagram is a really useful part of your water management program to help give the members of the team and others a really quick snapshot of, how the water system is distributed, how water is delivered to people, how it's tempered, and then which control measures are implemented to address and identify hazards as part of the risk assessment process. And then finally, we have program administration control measures. These are going to be things, like meeting with the water management team regularly to review how the program is going, doing that validation and verification, is it working and how are we demonstrating that it's working, having those discussions and administering the program to make sure that it's working appropriately. And this is where your hazard control plan comes into place. So while these process flow diagrams are a really critical piece and kind of a one-stop shop for how your program is implemented, your hazard control plan is really the written document that identifies all areas of risk. It might assign a qualitative comparative risk, low, medium, or high, depending on what observations you might have of those risk factors, which, just to remind us, are temperature, stagnation, lack of disinfectant, and biofilm scale debris buildup. So your hazard control plan is going to be the main document that identifies all of those hazards and then really specifically states what is being done to minimize or reduce the risk associated with each hazard. So it typically has a risk rating and a rationale, again, high, medium, or low, and why you've decided, why you've assigned that high, medium, or low risk. It will also spell out in more detail the exact control measures that are implemented for the hazard and what corrective actions are going to be implemented if those control measures are out of the normal range of what you expect to see. It's going to state what those target ranges are. For example, for hot water, you're going to want to deliver your hot water as close to 120 or higher if possible. So that would be your target range for hot water. Your cold water might be less than 77. So those target ranges are going to be specifically listed in the hazard control plan. And then if your temperature measurements are outside of the ranges, then it's going to state what corrective actions are taken. You're going to increase the temperature set point of the heater. You're going to potentially do some flushing. It will also state what frequency you're doing the monitoring. Are you monitoring weekly, daily, monthly, annually, etc.? Who's responsible for implementing that control measure. And then it might also list some regulatory and guidance references so that people have quick access to the documents that spell out why the hazards are there and what needs to be done about the hazards. So this is just a really quick, a quick snapshot or a screenshot of what our hazard control plan document looks like and what standard operating procedures and corrective actions might accompany the hazard control plan. So we've talked about lead, we've talked about Legionella, we've talked about copper a little bit, and hopefully you've been able to see that there's while there's definitely some significant differences between lead and Legionella, lead exposure is primarily a concern for consuming or drinking water. It's a chemical contaminant. It's not a living organism, whereas Legionella you're exposed to Legionella by inhalation of contaminated aerosols. And it's a living bacteria. There are certainly, while there's some differences, there's certainly some similarities as well. So we sort of juxtapose the CDC reopening guidance here so we can draw upon some of those similarities. Certainly you can see the theme of flushing. CDC recommends that in addition to flushing, which flushing is not going to be the only control measure that's going to be effective for eliminating lead, it still is a critical component. And flushing is also comes up in terms of Legionella control and management. We also see temperature is a theme, using cold water for drinking and cooking for lead, and then monitoring temperature, making sure that temperature is above or below the growth range of the organism for your hot and cold water systems. And then you can also see that cleaning and disinfection and maintenance are a commonality as well. Cleaning aerators and maintaining filters as part of the lead management program, and then also performing regular cleaning and disinfection, maintaining your water system is going to be part of your Legionella management program. Where we don't see some of the differences, lead concerns are not as much of an issue in a hot tub or a spa because you're not necessarily drinking the water, similarly with a decorative water feature and a cooling tower as well. So certainly some differences, but also some common themes. And so really when you're addressing these hazards in your building, developing a water management program, you can weave both lead, copper, other chemical contaminants into a waterborne pathogens management program and achieve good control. You just need to kind of think about the similarities and differences and make sure that these are addressed in your water management program. So this is just another reiteration here on the control measures, specifically for lead, understanding the water supply. CDC recommends collecting water samples for lead, again, not required, but a recommendation. Using cold water for cooking, drinking, etc. Performing cleaning of fixtures and aerators to make sure that debris is not building up on the back side of them, and performing maintenance, particularly with filters or filtration systems. In terms of Legionella, just to repeat here, developing a water management program and administering it and implementing it, setting hot water heaters greater to 140, performing flushing at all domestic water fixtures, components, and the system in general, moving water, preventing stagnation, performing cleaning and disinfection if needed, making sure hot water heaters are clean and flush, that there's no debris buildup on the bottom of the tank, performing cleaning and disinfection of cooling towers, decorative water fountains, features, and hot tubs and spas, making sure that the disinfectant is adequate in those systems where it's needed. And then just general maintenance, monitoring temperature, disinfectant, and pH for Legionella control, maintaining domestic water systems and components, keeping them clean, minimizing scale, and then performing cleaning and disinfection again in those three systems, cooling towers, fountains, and hot tubs and spas. So we just wanted to touch briefly on sampling. Sampling comes up a lot, and there's a lot of questions about sampling, whether it's required, whether you have to do it, and how to do it when you decide to do it. So we recommend, as industrial hygienists, that if you are going to take on sampling, and again, there's no requirement to sample, while there are recommendations to sample for lead from CDC, there's nothing to say that that's required in a building. The municipalities and public water supplies have to sample, but inside a building, there's no regulation that says that it's necessary. So again, if you do decide, and it's really a risk management decision as to whether or not to take samples, but if you do decide to take samples, think very carefully about a sampling plan. Make sure that you know where you're going to collect samples and how that data is going to be interpreted before you go and collect those samples. So develop a sampling plan, understand how the water system is distributed, carefully select those sample locations, numbers, volumes to be representative of your building. Select the laboratory method very carefully, consult with the laboratory, consult with a consultant to make sure that you're using the right methods. Understand what guidance, how you're going to interpret those samples, what interpretive guidance are you going to use to interpret those samples so that you know what those samples mean when you get the results. And then be prepared to implement corrective actions. If you do collect samples and you do have actionable levels according to the guidance that you select to interpret, then you do need to be prepared and ready to implement corrective actions if an issue is identified. So this is best done through discussion with the water management team, consulting with a laboratory, consulting with a water treatment vendor or professional, or a qualified consultant. Facts, we recommend that one of the best ways to collect samples is after you have implemented controls as that validation step. So implement the control measures first, make sure your water management plan is implemented, that it's going well, that you have good record keeping, that the control measures are being implemented, and then collecting samples to validate and demonstrate that your program is working to control Legionella and lead in your system. There might also be, certainly when it comes to Legionella, if there are outbreaks of Legionnaire's disease or cases of illness associated with Legionella or other waterborne pathogens, there may be a definite need to sample. And certainly if the local public health authority is involved, they may require sampling or want to perform sampling themselves. So there are some sort of extenuating circumstances where we really strongly recommend sampling, or it might be required by an authority having jurisdiction. And then for lead sampling, again, after the water management plan and the water control measures have been implemented, after flushing, cleaning, verifying those maintenance practices and control measures, and certainly prior to reopening, if you're going to collect samples, that would be the best time to collect them then. So we've given you a lot of information, and we want to just kind of follow up or close with, well, what does this mean for you and what do we do now? As buildings are reopening, these are the recommendations that we have prior to full reoccupancy. Certainly developing a water management plan that considers Legionella, considers other waterborne pathogens, and considers lead and other waterborne contaminants. And having a dedicated team to manage that program and implement it. We recommend that that be a multidisciplinary team. You have members of the facilities, maybe management, maybe a consultant engaged. You want those members of the team to really understand the water and how it's distributed in the building and have a good understanding of the risks and hazards that need to be identified. So review and understand the plumbing plans and configuration for the water usage in your building. Perform a visual inspection, look at the system fixtures, look at the components, make sure they're working properly and they're in good condition. Maintain your hot water system. Make sure that the temperature of the hot water heater is at or above 140 wherever possible. Follow the CDC guidance for prevention of Legionella growth. And then perform flushing. Flush the building's plumbing system. This is really important for moving water through the system, water that's been stagnant for a good period of time, upwards of a year now. And doing that flushing as close to reoccupancy and prior to reoccupancy as possible. And then develop a regular schedule as needed for targeting flushing in low-use fixtures, areas that may not be fully occupied. You may need to flush those more regularly in order to maintain and reduce that water stagnation. And then if you have questions about your water supply, certainly contacting your water utility, you can contact them with questions, understand the status of water usage and the quality in your area, ask for a copy of the results, most recent sampling results, the consumer confidence report, which should summarize the results from the previous year. This is available as a handout to you as well. So this is just some additional resources that you may find useful in terms of addressing lead and Legionella in buildings that are reopening. So I won't go through these in detail here, but there are hyperlinks in the handout and you should be able to click and access these resources as well. This is just a select number. There are many other resources available. These are some that we think you may find useful. Madeleine, I'll hand it back over to you.
All right, thank you, Megan. And those resources, I'm going to go back one slide actually here, if I can. This link for the guidance on reopening buildings from the CDC and their link for the Legionella and Legionnaire's disease. It's a very well organized page and it lists off the appropriate guidance documents and other references and resources as well. So that's a really good starting point. And the EPA link for information on maintaining and restoring building water quality following a shutdown, they have a nice little checklist that goes along with that, that kind of goes through the steps that we talked about. So some final thoughts on this. I know it seems really overwhelming. You know, can't we just flush the water and be done with it? And, you know, water, for as seemingly simple as it is, water systems are a little bit more nuanced. The best thing that you can do is be well prepared and to have a plan. And so I have this prior preparation prevents poor performance. Before my life as a consultant, I was in the military, and this is something that we really live by. So having a plan first before you begin one of these adventures is just really important. You also want to set yourself up for success. So building that water management team that I mentioned earlier, that's the first step in developing the program, is really important, because the amount of teamwork and communication and buy-in that you have from the team is critical to the success of the program. And this graphic here is from the CDC toolkit, and it talks about the different critical things you need to consider when selecting who is going to administer and oversee the water management program. One of the last things I'll mention is, you know, we get a lot of requests. Can you just come out and sample the water? And before sampling, you want to take into consideration all those things Megan talked about. Sampling is very costly. It can be, particularly when you're sampling for bacteria. It takes a lot of time. You know, you have to allow the bacteria to grow on those cultures. And then if you don't have a plan in place for how you're going to interpret those results, as we saw with lead, you know, the action levels and the recommended levels were all over the map on that. You need to be able to know how you're going to interpret those and which one of those regulations applies to your facility. And certainly a consultant can help you with that. Those guidance documents can help you with it. When it comes to Legionella, interpretation of the results is really, really important, and how you're going to analyze those, because you know, if you don't have this plan in place, if you don't have your prior preparation and you just go out and collect samples, suddenly you're looking at these results going, well, what do I do? And potentially a public health officer could be involved as well. So having some idea in advance of how you're going to conduct any corrective actions and how you're going to interpret those results is really important. So, you know, at a minimum, I would take a look at that CDC site, access some of those resources, use that checklist, flush your system, get your plan in place, and certainly feel free to reach out to us with any questions that you may have regarding anything that we talked about in this webinar, as well as, you know, what some of your options and obligations might be as you move forward in reopening and coming back to work. So that's all I have, Megan. I want to thank everybody for their time and attention. I know it's a lot of webinars we've all sat through in the last 15 months, but you know, we talked about creating this webinar and presenting it for a few months now. And as the COVID guidance has evolved and changed constantly, it looks like we are, particularly in the state of California, we're at a point here where pretty much everybody's going to be coming back to work within the next couple months. And, you know, facilities are reopening. So it's important that this information is accessible to people. As consultants, our priority is the public health first. You know, something we stand by at FACTS is the integrity of the science and staying on top of all the most recent guidance. So please feel free to use us as a resource, and you can access this information through a video afterwards. And then, of course, we have handouts. Included in the handouts is another piece of information, CDC's considerations if you're going to choose to work with a Legionella consultant to assist you with developing a water management program or addressing any Legionella issues in your water system. So that's all of our stuff. Thank you very much. And Megan, thank you for your assistance with this project, and Taylor for getting everything set up.
Yeah, great presentation, ladies. One thing I wanted to note on the handout section, those are not showing up for some reason, so I will make sure that those are included in the email that we send up, that we end up sending out following this webinar. that will include also a link to a recording of this presentation and Megan and Madeleine's contact information in case you'd like that. We did have a few questions come in, so I want to go through some of those here that we have time for. The first one was, I get the biodegradation of the biocides, but how is the temperature range conducive to growth maintained in dead or stagnant legs?
That's a great question. So, and Madeleine, if you don't mind, I'll take this one. So you want to avoid temperature in the growth range of the organism. And it's important in order to get fresh temperature and fresh disinfectant to the locations that you want to get them to, you need to have water movement, right? So when you have stagnation, or we call them dead legs, effective dead legs or engineered dead legs, and those dead legs lose temperature and disinfectant relatively quickly. So that's why incorporating flushing as part of your water management program, in addition to maintaining temperature, using both of those in conjunction with one another is really critical in terms of maintaining your water management program and controlling for Legionella.
Thanks, Megan.
I would just add to that too, that not all disinfectants are created equal. Some are more effective against penetrating biofilms than others. And so as you're looking at, not just getting fresh disinfectant to that area, making sure that it's adequate, and getting some more information about the type of disinfectant that your municipality uses.
Great, thank you, Madeleine. The next question was, are there guidelines for flushing the drinking water systems, such as duration or frequency of flushing?
Yes.
Yes.
So
I'm going to pull up the resource page while you answer that. Sorry.
Yeah. Yes. So there are, and there's no necessarily right or wrong way to. There's many ways that you can do flushing, and so not all guidance is consistent, but there are consistent documents. There are guidance documents available. They're just not all consistent with one another. But something to look at would be the American Water Works Association, the AWWA document that talks a lot about flushing. There's the ESPRI document that talks about flushing as well. And then the ASHRAE documents discuss flushing, not necessarily how to flush, but sort of where and why flushing needs to be done. But essentially, just moving water, and you're going to have to use some judgment in these situations. And that's why understanding the building water system is really critical. That can help you to know how long the run of piping is, such that you can estimate how long to flush. Is the piping run really long and maybe you need to flush for 5-10 minutes, or is it shorter and maybe a couple of minutes will suffice? But essentially, you want to just make sure that water moves through your building. So looking at those guidance documents will give you a little bit more information on different approaches to flushing.
Great. And the next question was, what is the ideal chlorine level that you would want to see entering the building, and at what point of use?
That's a great question. So not all municipalities treat with chlorine. Some treat with monochloramine. So it really depends on what the municipality is treating with. For chlorine, typically a minimum concentration of 0.5 part per million is recommended. Even more though, depending on the water quality, may be necessary. But that very minimum is typically what we see in the guidance is 0.5 part per million. And ideally, that would last all the way through your building, through the heating system, withstanding all the heating that goes on, and go all the way to the last points of use. It's very unlikely that occurs. So ideally, you would have a 0.5 part per million concentration for chlorine at the very most distal, very furthest points of use from where the building enters the water. So typically the municipality is not required to give you anything but a detectable concentration. And so you may not even have sufficient concentration of chlorine coming into the building. For monochloramine, while the minimum is 0.5 part per million, typically we like to see, and in most guidance documents, we see a range of 1 to 3 part per million for monochloramine.
Great, and we've got time for about one more question. There were several that came in, so if your questions were not addressed through the ones that we've been able to answer, I will make sure that we include Megan and Madeleine's contact information on that email we send to you later today, so you can reach out directly. But the last question that we'll have here is, would you recommend sampling for Legionella only in areas where aerosolization is occurring, such as showers, since that is the usual route of infection?
Madeleine, you want to jump on that one?
Sure. So there are resources for how to select sample locations, and that is at the CDC website. You want to, you do want to be selective about where you sample, and you want to collect samples that are representative of your circulating water systems. So when you're looking at aerosol generating things like showers, certainly you want to look at that fixture and determine whether or not that seems to be a high risk fixture. The other thing to think about when you're collecting these samples, so let's just talk about your shower head, right? So let's say that you have some corrosion, some scale on the shower head. Perhaps you have a biofilm that's formed there. You've cleaned the exterior, but maybe the biofilm's on the interior where you can't see it. And you collect a water sample after flushing the water through the line, and you don't see any detectable levels of Legionella. You've essentially kind of missed the opportunity to get some information that may be diagnostic about a localized formed biofilm. So there's pre-flush sampling and there's post-flush sampling. The pre-flush or first draw sample is a sample that you pull, that is the first water that comes out of that fixture. And that water is theoretically representative of what is localized at that fixture. Now, if you have a really virulent, well-established biofilm, it may not show up in that first draw sample, but it's one of the ways in which you can tailor your sampling event to get the most amount of information possible from each individual sample. So you want to sample from representative points in your water system, near and distal, and then you want to be able to get a few representative samples of pre and post-flush. And those post-flush samples are going to be very, very valuable to you in understanding what's happening at the furthest points in your water system. Other places you want to consider sampling potentially would be hot tubs or spas, would be some of your water processing components, or if you have a cooling tower. But again, the CDC guidance does help guide that process a little bit. And of course, you know, every building and system is a little bit different. The more that you understand that system, as Megan was saying, it's really important to have those. I know it's hard with plumbing diagrams. Trust me, I've seen some, you know, like digging through faded 1970s hand-drawn plumbing diagrams, or maybe they're missing. But the more that you can understand that system, the better you can design that sampling event.
Thank you, Madeleine. That will conclude our webinar today. So thank everyone for attending. Thank you, Megan and Madeleine, for presenting, and keep your eye out for an email with all of the resources we mentioned later today. Take care, everyone.
Thank you.